evening and welcome to our COVID-19 update. I am Ladi Akiridoluale. Here are some of the highlights at this time. Nigeria's Center for Disease Control confirms 4 new cases, bringing the total to 139 cases, just as the number of those that have recovered and have been discharged increases to 9. Presidential Task Force gives update on COVID-19. Aviation Minister explains category of essential flights to operate. And Italy records 837 deaths and Spain a record 849 in the last 24 hours as global number of cases nears 800,000. Good evening and thanks for being with us. I am Ladi Akiridoluale. As we speak, the total confirmed cases of the COVID-19 virus in Nigeria, according to the Nigeria Center for Disease Control, is now 139. Of the 4 new cases, there are 3 in the Federal Capital Territory and 1 in Lagos. A state-by-state breakdown now shows that Lagos has 82 cases, the FCT has 28, Oyo has 8 cases, Osun has 5, Ogun 4, Kaduna has 3, Enugu, Edo, and Bauchi have 2 cases each, while Ekiti, Rivers, and Benue have 1 case each. The country has recorded 2 deaths from the virus, while the number of patients that have fully recovered and have been discharged is now increased to 9. The federal government will be deploying an expert on infectious diseases from the Ira Specialist Hospital in Edo State to Abuja to help with COVID-19 case management. This is one of the measures towards containing the pandemic outlined by the Minister of Health, Dr. Osagi Ehanire, at a media briefing in Abuja today. The minister, who confirmed at the time 135 cases, now 139, also says 5 of the cases, now 9, have been treated and discharged. According to him, more laboratories have been opened and more testing machines will be available in the weeks to come. The Secretary to the Government of the Federation, Boss Mustafa. Now, more high-profile Nigerians have continued to test for COVID-19. The latest is the Inspector General of the Police, Mohammed Adamu, whose result came out negative. About 11 of the IGP's officers whose blood samples were collected also tested negative. In a statement by the Force Public Relations Officer, Mr. Frank Mba, policing is a high-contact job with its risks, it says, and the police boss is calling on all police officers nationwide to adhere strictly to precautionary measures in the course of their duties, while calling on members of the public to obey restriction orders by constituted authority. Even though Lagos State has the highest record of confirmed COVID-19 cases, the state is stopping at nothing to halt the spread of the virus. At a press briefing today, the State Commissioner for Health, Professor Akin Abayomi, confirmed that the isolation centers are fully functional and producing desired results. He also explains the importance of the lockdown and appealed to Lagosians to comply with this directive.
Our survival in Lagos so far is 100%. 100 out of 100 are still alive. And out of those patients, we've discharged 8 fully recovered. And we will soon be discharging in the next week as the tests come back negative. Remember, I said we have to have 2 negative tests, because if you have 1 negative, sometimes you become positive again for a few days before you become fully negative. So just to protect the community, we're making sure that you have 2 consecutive negative results. We are not struggling at the moment with healthcare professionals, either nurses, doctors, or ancillary support. And yes, we're receiving volunteers. People who have gone into early retirement are coming back. People who are allied healthcare professionals are coming back. They're going through training. We're training every day, Monday to Friday, sometimes over the weekends. So we're training several tens to hundreds of practicing practitioners and those that are volunteers. And the volunteers can be cleaners, they can be assistants. There are all kinds of people that go into the ward, and all of them require training. So far, we're doing quite well. We're preparing for that 100-bed facility at Onikon that requires almost 50 to 60 personnel that are being trained right now. They'll complete their training tomorrow, then they'll go for certification, and then they'll be deployed to that facility. So a lockdown is just essentially to grind down movement in a city, to minimize it to as much as we can. It will never be 100%, but our job is just to slow it down to as much as we can. We don't want to come out with, security brutality. We don't want to demonstrate. This is not a military state. We're a civilian democracy. Children will be children. We discourage it, and when we see it, we would advise against it. But also, as civilians, we must play our part in this whole process of lockdown and social distancing.
Professor Akin Abayomi, Lagos State Commissioner for Health. And President Muhammadu Buhari has signed the COVID-19 Regulations 2020 into law, declaring the virus a dangerous infectious disease. The presidency says the decision is an exercise of the powers conferred on the president by Sections 2, 3, and 4 of the Quarantine Act. The statement, which was tweeted by the president's aide, Bashir Ahmed, says, quote, "The regulations, which will be effective from today, also give legal backing to the various measures outlined in the president's national broadcast on March 29, 2020, such as the restriction, cessation of movement in Lagos, the FCT and Ogun states, and others towards containing the spread of the pandemic in the country," unquote. Our correspondent Ibrahim Adra joins us live from the Federal Capital Territory in Abuja. Ibrahim, what is the latest on the stay-at-home order to curb COVID-19 in the nation's capital?
Well, let me begin by saying it's heartwarming to hear the Secretary to the Government of the Federation, who is the President of the Chairman of the Presidential Task Force, saying this today is like a test case, and that they're going to sit back and review from information they are getting and talk with the security agencies to see how they can find modalities of implementing this lockdown. Because what we saw in the morning today leaves much to be desired. Don't get me wrong, the task force in the city center did a yeoman's job. We saw almost 100% compliance within the city center, that is. But if you go to the entrances and the exits from the Federal Capital Territory and some of the suburbs, and where you could aptly describe as slum within the FCT, I'm talking about Durumi 1, Durumi 2, Nyanya axis of the Federal Capital Territory. It's not encouraging at all. People defy the directive with impunity. You see them coming in and you wonder where they're going. The hold-up that was created is as much as you would see on any other day on that side. There are security operatives around, but somehow they speak to them and they are allowed to go through. So I don't know what excuses, but they certainly were not all on essential services. You see those people who are perhaps allowed to go by virtue of what they do, carrying so many other people who perhaps have no business being on the road on a day like this inside their vehicles, and they were all coming into the FCT. You now wonder where they are going. That presents a huge challenge. In the suburbs where I was talking about, Durumi, for instance, it would appear as if they are not part of this country and don't even have the information we're talking about. I don't see how the security agents, I mean, we don't have that number, do we? That will be able to go to these places and ensure this thing. It's rather unfortunate that some people had to be coerced to be able to stay back home, considering the nature of this virus that we are talking about. Importantly, too, during that press briefing, there is two issues that are of concern to them here in the FCT. One is some sort of panic where people calling and are requesting for tests. That is a big problem for authorities. They say that is a clog in the wheel of the work they do. People who have, if you sneeze once, you want to call in and get tested. If you cough, you want to call in and test it. That is overwhelming and is slowing down their work. And then the SGF also spoke about something that bothers him and should bother any right-thinking Nigerian, the denial on the part of some people. Some people still just don't believe that there is any virus that they should be afraid of. And unfortunately, like he did pointed out, they are highly placed individuals. And so that rubs off on the followers they have down the ladder. Overall, very good compliance within the city center, but there is a lot of work to be done on the outskirts. Ladi.
Now, Ibrahim, do you think that this may have to do with, you know, increasing the awareness level, both on the part of those who are doing the enforcement, that is the security agencies, to understand what is at stake here, and then in the outer areas, the outlying areas of the FCT that you spoke about, Durumi 1, Durumi 2, parts of Yaya, that is a question of awareness about what this involves and why this is the situation, and not just that those people wanted to flout the stay-at-home order?
I will have to say yes to some extent. Perhaps it's at this point we might need to ramp up our information dissemination, the quality of information we disseminate, what we are saying, to be able to see if we can do some behavioral change. But the other one, I'd like to think they have been deliberate about it, because I had the privilege of speaking to a few of them. You know, when you talk to them, they seem to have a justification for being on the road. That's the way they sound. They tell you how they need to go to work, they need to go sell whatever it is they are selling to be able to feed their families. They made it sound as if it's simply impossible for them to stay back home for whatever reason, because either way, it's either you can tag the virus or you have other problems, financial, social, that you have to contend with back at home. So yes, to an extent, we perhaps need to ramp up the communication, very effective communication, behavioral change communication that will trickle down. Even though, if you ask me, perhaps have we left that a little too late? Maybe. Can we ramp it up and make improvement? That again is a possibility. But obviously, back at those places, there is a lot more to be done, Ladi.
Thank you very much, Ibrahim. Well, of course, we'll be looking forward to updates on the situation. Let's see whether there's improvement tomorrow. The SGF, as you pointed out, they talk about working out enforcement modalities to be sure about what's going on. Thank you very much, Ibrahim, our correspondent, Ibrahim Adra from the FCT Abuja. And still to come on COVID-19 special update, we'll have the situation report on what is happening in Lagos, the nation's commercial capital, plus our global update. Please stay on with us. Thanks for staying tuned. Welcome back to our COVID-19 special here on Channels Television. And as we did promise, here's the update on the situation in Lagos. Earlier today, there was traffic buildup on the Lagos-Ibadan Expressway as security operatives mounted barricades to check vehicular movements. Our correspondent, Dare Dowu, who has been monitoring the situation on the roads, now reports.
This is Lagos without its buzzing, energetic state. Roads closed, movement restricted, and business put on hold. The stay-at-home order, according to the president, is a matter of life and death, and the initial lockdown period of 14 days is expected to be complied with by all except few exemptions. But what is the level of compliance across the state?
It's day one of the lockdown in Lagos State, and one of the ways to check the level of compliance is to come to a place like this, the 3rd Mainland Bridge. This bridge is known for its very high vehicular movement. A lot of people ply this bridge either to go to work or to return to their homes on a daily basis. But with the president's directive and the enforcement in place, a few cars are seen passing around, but it doesn't come close to the volume this bridge is known for.
Lagos-Ibadan Expressway, the major entry point into the state, has a picture of the lockdown in full effect. There are roadblocks on major roads with law enforcement officials on standby to ensure that those who do not have business being on the road are not allowed to move past their barricade.
So on the road is empty. Now there are places of walking around, that's where we have motorized patrol. Like all the markets that have been closed Lagos Island, like all the businesses that have been closed Lagos Island. So we have mobilized more policemen from those in offices. Almost all police officers that are in offices are now out on this. So that's to increase the presence of policemen on the road to enforce and to make visibility policing present. So since you've started now, there's not going to be. Today the first day accepted. But in the next 48 hours now, we know that people will voluntarily comply.
It's all about we breaking the chain of the transmission. If everybody stay at home, we just break the chain. The thing will not just fly like that and come on you. But if we stay at home and avoid contact with somebody who is a carrier who has it, and you may not even know that he has it, he may not have even developed symptoms, then we will all be contributing in curtailing the virus. And that's the whole essence.
The security agencies say they will continue to effect the directive of the president with professionalism and synergy, asking Lagos residents and travelers to cooperate with them. Dare Dowu, Channels Television News.
Kano State, at the other end of the country, the governor, Abdullahi Ganduje, is leading the line in the enforcement of the state's travel ban and land border closure. Today, the governor personally inspected the enforcement of the interstate travel ban in and out of the state as a precaution against the spread of COVID-19. The governor's convoy stopped at major entry points to the metropolis, where he stopped several truckloads of people from Lagos and Abuja, states with the highest number of COVID-19 cases. Well, joining us to take a look at how this stay-at-home order and curfew imposed by the federal government in Lagos, Ogun states, as well as the Federal Capital Territory, is Dr. Alero Roberts, a public health physician. Thank you so much for joining us.
Thank you for having me.
Some of the things you've just seen.
Yes.
Is it a fair comment to say we should have expected them?
Yes, I think it's a very fair comment to say we should have expected them, in the sense that we've never gone through this before. We are used to a lockdown for, say, the elections, and once upon a time for environmental sanitation. But a lockdown of this nature is something is a lot more unusual. A lot of people are thinking it's just like an extended public holiday, a time to go around and visit friends, catch up on a few visits here and there, have people over. But none of that can happen, Because what we really want, as the gentleman in the uniform said, is to break the chain of transmission, i.e. we have to stop and really enforce the social distancing and make sure people are not sort of just hanging out with one another and transmitting the virus, even though they may not be exhibiting symptoms.
Now, are you not scared? Because people keep pointing to the analogy of a number of other countries whose infection rates were slow to start with, and they didn't quickly go to these measures that we're trying to implement now, or maybe they didn't take them quite as seriously, and then the curve moved straight up, and now they're having really high numbers of both infections and fatalities. So does it also speak to the fact that maybe the importance of what is being done, which is the question I asked our correspondent in Abuja, who was talking about the fact that compliance was quite low outside the city center. Is it a question of people not yet understanding how important this is?
Absolutely. People do not understand how important this is. And it speaks to, I'm sorry, decades of poor education in the country and people not really understanding what disease transmission really means and what the difference between, say, the transmission of a disease like, say, Lassa fever and a disease like COVID-19, which is more droplet spread and, you know, airborne, as it were, not airborne strictly, but aerosolized in the air. So the difference is that people need to really understand that you can be asymptomatic and spread the disease. So the stories we're hearing of people who came in to the country and were merely, and it seemed like just a suggestion that they should self-isolate for 14 days, when it really should have been made a mandatory lockdown for them. And they sort of come back and, oh, the excitement, so-and-so's back, and let's go and visit so-and-so, and let's go here, and let's go out. And that's what happened. And suddenly we had this upsurge of cases because you've got contacts and contacts of contacts. So, and then I look at what's happening in Abuja, like, you know, was said, like we saw on the newsreel earlier. And I'm wondering, how do we get the message down to the masses, the grassroots, that this is a serious disease and that this can spread very fast in those areas? And the only way we can do that is if we can break the chain of transmission, at least in the metropolitan and urban areas. We will prevent it getting into the grassroots where the spread will be like wildfire.
Now, that then brings up some other part of this, which is the question of social distancing. It appears as if even more difficult to comply with than the restrictions is the issue of social distancing. And some of those who sat in the chair they are sitting in now talked about the fact that we are very huggy, touchy type of people, and that so indeed. To change that over such a short period of time is difficult. It is very difficult. But we're going to have to. We're going to have to if we're going to break that chain of transmission. We're simply going to have to. Now, you'll notice that I'm sitting here with my hands very tightly curled, which is very unusual for me because normally I'd be waving them around and trying to gesticulate and make my point. The danger is that I will touch my face. And, you know, definitely, I mean, we always talk and we normally are tapping each other on the shoulder and, you know, tapping each other on the elbow to bring attention to a point we're trying to make. That's all behavioral change, behavior that needs to change and needs to change quickly. But we have to do it, and we have to keep emphasizing it, and we have to keep drawing awareness to it with all the jingles and with all the things on TV telling us what to do and what not to do. Even the hand washing and the sanitizing, at least we are getting on top of that, a bit closer to that. But for instance, I was sort of out this morning, sort of checking, and I came across a police checkpoint, and the first thing the policeman does is that he stops the car and leans on the side of the car. Which probably means that he himself doesn't quite know about it. Exactly. You know, and I had to call the second guy and I said, look, tell your colleague not to lean on the side of the car because that's a point of infection and he has a family. Indeed. So, you know, in trying to intimidate the driver or whatever, he may actually be inadvertently endangering himself and his family members. So these are lessons that we're going to have to keep repeating over and over again. Now that brings us to the issue of testing. When you look at it, Nigeria's numbers are still fairly low, especially when you compare them to other places, South Africa, for example. But then when people say, if you take that against the number of people who have been tested, we're way behind. from the report we have now, that's also being complicated by the fact that some people who've coughed once or who've sneezed once are calling the hotline and demanding tests. How do we navigate that? The difference between people who really are just calling because they don't have the correct information and then real people that we need to test and find out, especially those you mentioned that they don't show any symptoms, but they're carrying it all over the place.
Well, we do have a well-structured protocol that we apply. If you do call in, somebody will apply that protocol on you. And of course, needless to say, I'm not going to tell you what is of the protocol so people don't prepare their answers.
Fine.
But we do apply that protocol and determine whether you do need testing or not. And that's the work of our surveillance teams that go out to actually check out these cases and what we call case investigation. And the surveillance teams are going out and doing these case investigations and collecting the samples if necessary. You are right. Epidemiologically, we should be doing a lot more testing. And we are ramping up the testing facilities as fast as we possibly can. But bear in mind that this is a molecular test and therefore has a process of time within which it must be done. As soon as the rapid test kits are accredited by WHO and NCDC, I'm sure they will be rolled out and will make testing a lot easier and a lot faster. But we do need to separate the worried well from the actual possible persons of interest that we need to be testing.
Now, we're going to take an update from some of our correspondents in various parts of the country. But before that, I also want you to talk about the medications not to use, because that has presented a different
angle
of problems, because even those who have no symptoms, who have nothing, are saying, to prevent. So please speak again to the fact that some of these things don't work, and please speak about what works and what they are to do.
I will do that.
Please.
Okay, so we've all heard the story about the chloroquine, hydroxychloroquine, and azithromycin. The truth of the matter is right now there is a 42-country clinical trial that is going on that has been that's accredited by the WHO to go on. These are drugs that purportedly act against the virus, i.e. the virus has to be in you for the drug to have a target to act against. So there is no prophylactic value in loading yourself up with these drugs if you don't have the virus. And that's the difference between prophylaxis and prevention. Now, considering that we're a nation that many of us, of course, of our vintage, grew up at a time when we used to take Sunday medicine as prophylaxis against malaria, sadly, these drugs cannot be used like that. And because these drugs have quite devastating side effects, I was just reading it up again just now, it does cause irreversible blindness and deafness if taken out of context. These are drugs that should only be prescribed by trained clinicians. In fact, I wouldn't even prescribe it because I'm just a public health physician. I would ask the advice of an infectious disease specialist who is properly trained in the use of these drugs. Now, the clinical trial that is ongoing, what I read about it, is that they're looking at several different arms of treatment to determine A, the toxicity, B, the appropriate dosage, C, who it's going to work in and who is not going to work in. Then don't forget that for pregnant mothers and young babies, is there lasting sequelae to the use of these drugs? Right. These are all questions that first need to be answered before the drugs can properly be
put to public use
in the right hands. These
very
are never
important. In the
right hands is very, very important.
Now, I'm going to put you on pause, Doc, because, as I said, we want to take a couple of reports from some of our correspondents in the various states and find out what exactly it is that they are doing. So let's start off, shall we, in Edo State, where the governor, who has been on self-isolation for some days now, has made a state broadcast today where he asked indigents of the state not to be complacent in compliance to efforts taken to stop the spread of COVID-19. Governor Godwin Obaseki also announced more precautionary measures against the virus in the state.
We are establishing over 100 screening points across all local government areas made up of teaching hospitals, general hospitals, primary healthcare centers, and private hospitals. Anyone with known symptoms or suspects that they may have been exposed can go and talk to a trained healthcare worker who will provide care according to the defined protocols. This is offered free of charge to our people. We are working closely with the Irua Specialist Teaching Hospital, one of the 6 designated testing centers in Nigeria, to expand their capacity so that they can test more people. Additionally, we are planning to open a new specialized testing center in Benin City. We now have isolation centers with a total of 280 beds located at the Stella Obasanjo Hospital, Benin, University of Benin Teaching Hospital, Irua Specialist Hospital, and Auchi General Hospital. In addition, we have secured 25 additional ventilators, increasing the total number of ventilators to 28. 10 intensive care units now exist in the state to take care of critical cases. I chair the Edo State COVID-19 Response Committee, which meets daily to evaluate and review all the latest developments as it relates to COVID-19, while the Deputy Governor is chairman of the Technical Committee. The COVID-19 virus does not move. It is people that move it and then spread it. You can stop its spread by maintaining social distancing and stay at home, while the healthcare workers do their best in containing the virus.
Governor Godwin Obaseki of Edo State. Meanwhile, some Nigerian celebrities and movie makers have joined government in urging the citizens to stay safe and stay at home. Our entertainment correspondent, Bidemi Dairo, visited some of them today and reports that they are as concerned as any Nigerian on containing the spread of the virus.
We need to really understand the severity of the COVID virus. Well over 700,000 people and counting have been cases, like reported cases across the world, and people are battling. First world economies are battling with this situation, so let alone us in the third world. Like, I encourage everybody, I am begging everybody to sit at home. Sit at home, quarantine yourselves, isolate yourselves, practice all the measures. The WHO has basically told us exactly what we should do. You should wash your hands, regularly, keep your social distancing, make sure you don't cluster, don't go to places where people are clustered. Personal hygiene is very key at this point in time. And then most of all, prayers, because sometimes a lot of people say God, Nigerians have wronged God, and God is so mad at Nigerians, and God won't come and save us. But I dare say that God created everything, and God is still in charge, and our God of miracles would help us get through this.
Hi, it's Niniola. Corona is real. Please stay at home. Observe strict hygiene practices. Wash your hands, use a sanitizer, and be safe. I love you.
For every dark cloud, there's a silver lining. I want everybody, every Nigerian, to use this opportunity, to seize this opportunity as an incubation period for you to re-strategize, re-evaluate yourself, rest from the hustle, you understand, and look at things from the positive perspective. Yes, it's a devastating situation, but we are a nation that prays. We are a nation that believes in tomorrow. There's no place in Nigeria that Nigerians are in the world that Nigerians don't survive. We are survivors. We shall survive this.
For me, I just want everybody to be cautious, careful. Let them understand that, safety first. Let them understand that, forget about all the conspiracy theories and all that. We'll tackle that one later. But for now, the immediate thing to tackle is to make sure that this thing does not spread. Wash your hands with soap. That is one of the most efficient ways. Just keep a safe distance when you're around. Cover your mouth if necessary. Just do all the things that the health experts have said. Let's try to do those things. And just, pray that, this thing passes over, man. Because this is serious. Like, channels, one love. Spread the word, man. We got to be careful. Yeah.
All right. Welcome back to our COVID-19 special. We'll take a global roundup now, where the Johns Hopkins University says the death toll from the COVID-19 virus in the United States is higher than that of China's. meaning that there's a reasonably good chance that the U.S. will face a second wave of the pandemic later this year. The U.S. reports a death toll of 3,415 compared to China's 3,309. Meanwhile, Italy today confirmed 837 more deaths from the disease, putting the country's death toll at more than 12,400, the highest in the world, with the number of cases at almost 80,000.
The COVID-19 outbreak continues to ravage Europe, with each region's total confirmed cases approaching 400,000 and that of Italy nearing 100,000 as at Monday, and a death toll pushing past 12,000. The government announced on Monday it would extend nationwide lockdown measures until at least Easter as the number of new infections decline. Spain has been on lockdown for 3 weeks and streets remain deserted as preparations continue for a new makeshift morgue. Preparations are also underway to transfer patients in a tent to up to 1,499 coronavirus patients in Madrid's conference center, turned into a makeshift hospital. It recorded 849 fatalities overnight, the highest in 24 hours, although previous numbers have been lower. The British Prime Minister Boris Johnson says 170 million items of personal protective equipment have been received at hospitals, GP surgeries and pharmacies over the last 2 weeks, while the NHS trusts have received 2.5 million aprons, thousands of protectors, 218,000 protective masks, 1 million surgical masks and 11 million gloves. A 12-year-old is said to be the youngest victim of the coronavirus pandemic in Europe. She'd had a fever for 3 days, but her condition then worsened. Meanwhile, 3 in 4 Americans are said to be under some form of lockdown as more states tighten measures to fight the coronavirus. Maryland, Virginia, Arizona and Tennessee became the latest states to order citizens to stay home, meaning 32 of 50 states have taken such steps.
As if we needed more evidence that this is a very serious issue. Dr. Roberts, our last moments. That report brought to light some of what happens to those in the front line, those who are actually having to treat these people. What's your thought about that? How are we doing with respect to that?
We can do a lot better. We can do a lot better. I today had to receive reports from several members of our surveillance, registrars who have been sent on surveillance and contact tracing, and they're rather worried that they'd had to go out without adequate personal protection equipment. There have been a lot of donations, and we thank all the private organizations and the corporate bodies that have donated. But we still do need to have more. So if you feel like, please donate some more, because every time a frontline health worker goes out and they're not adequately protected, they do run the risk of catching the disease. And the one thing we cannot afford to lose in this country are the human resources for health.
We don't have enough of them already.
We're having to train them. We're training them every day. And it's such a waste of training. It's such a waste of time and resources if we don't protect them adequately so that they can go out and do what they have to do. My final thought, please stay home, stay safe, stay alive.
Very important. Thank you very much, Dr. Roberts. Dr. Lera Roberts is a public health physician, and the message is the same everywhere. Please stay safe. Please stay home, as regulations have insisted, social distance, all the other protection methods that we have been asked to take a look at. We'd like to hear from you. Tweet at us at Channels TV, hashtag COVID-19 Update Special Edition. I'm Ladi Akeredoluale. As we say good night tonight, we leave you with this song, On the Coronavirus by Cobhams. Do join our COVID-19 studio tomorrow at noon. Bye for now.